problem area of the musculoskeletal system is always the pelvis, and as we have already talked about, there is slight misalignment to Anna's feet in front of us, because you can see probably from the film is that the right foot is just that slightly bit longer than the left foot, indicating she's got a lateral pelvic tilt on her right side, so she's weight bearing more on the right side than the left. So you would anticipate that some of the pelvic muscles are going to be causing holding tension because of that pelvic misalignment, and that can also affect like the sacro-iliac joint there, the psoas muscle there, and the hip and even the sciatic nerve. So we've got to look at the whole pelvic area. So one thing that often gets neglected in reflexology is this area underneath the ankle bone. This is all the core pelvic muscles, such as your quadratus lumborum, the piriformis, and you've got your gluteus maximus muscle here. So quite a nice way to work all those core muscles is I'm using all my fingers to work all the area, and I'm allowing my fingers just to find the areas that feel the most tightness and tension held, and I'm doing exactly the same on the opposite side, and I can just feel the areas that are holding more knots or tension in those muscles. And obviously my intention is to release the tension. It's all quite tight, isn't it? And I imagine quite tender.
Mm-hmm.
So I'm trying to get more maneuverability around the ankle and the heel. To work the glutes, you can use your knuckle to work over that very tough part of the heel, and that should just feel really nice. But as I'm going over it, it's very congested and creaky and lumpy and bumpy, so lots of tension held in those muscles. Another technique can work to work the whole lower back pelvic area is to work the sacro-iliac joint with the hip reflex, and also on the other side I'm going to work the area around the lumbar. So I can actually work, you might want to come and look from above, all three areas. You've got your lumbar or sacral spine here, sacro-iliac, which is where the sacral spine joins the hip, and the hip itself. And look what I can do. I can work the whole foot. 3 reflexes, get all that ankle manoeuvring all around those points. And hopefully, that's releasing.
Yeah, it is.
Okay, that's a really effective technique. Thank you.